Right.
Tell us about the foods that are important to lower inflammation that we could be adding to our diet to help us
So the simple way when
fight
you
it.
look at plant-based diets is two things. Is first looking for color, because all color has a phytonutrient. So like if something's red, okay, so like watermelon and sweet red peppers or tomatoes, right? They have lycopene. Oranges and squashes and carrots all have like beta carotene, and we can look at folate from green leafy vegetables, and then the indoles and allicins and the sulforaphanes from the cruciferous vegetables like
Mhm.
broccoli and those kind of things. Blueberries for like the resveratrol, and then all the beans and lentils, legumes for the fiber. So every color that you eat, the more rainbow. And I know this is kind of controversial because some states won't let you say rainbow, but the rainbow color foods are important. You know what I'm saying? And that's the key, because interesting thing is that when we do testing for nutrients, what people don't realize is that antioxidants, which are all these colored foods, ACE, CoQ10, glutathione, and those kind of things like that, those are actually indirect anti-inflammatory molecules. So when I give curcumin in my basmaric and ginger and boswellia and black pepper, those are direct spices and foods that are anti-inflammatory. But when people are eating more vitamin A, C, E, and antioxidant pro-rich foods, those are also anti-inflammatory indirectly. That's a secondary action. So that's why when people shift it, so when we look at our patients, we actually test the nutrients, because a lot of people are like, oh, I drink a green smoothie or I'm eating a power salad. And I'm like, oh, that's all good for you. Please do that. However, we want to look at, just like when people check their cholesterol and their blood sugar and their thyroid levels, like what is your nutrient levels in terms of, are you absorbing? Like what is your digestive enzymes? Are you getting enough protein and fats and fiber? And are you absorbing? Is there dysbiosis or inflammation in your gut, or any kind of mycology, overgrowth or parasite or candida or bacterial overgrowth? This all affects how those food nutrients will play a role in their body healing. And so the goal is, a lot of people will shift to their diet, but if they're not fully feeling better, and there's like, hey, I did this challenge, or I started eating this way, my friend lost all this weight, they have all these positive benefits, but they're still struggling. Like, how come my blood pressure is still up, or how come my A1C didn't drop as well? Is because the body's not assimilating or digesting or excreting as correctly as it should. So just because we eat it doesn't mean that we're absorbing it. And that's one thing that we have to go further with individualizing our patient. Otherwise, they'll be eating more and more plant-based, but then over time they might get discouraged because they're not doing as well as everybody else.